when will India have a vaccine against coronavirus disease? And how safe and effective will it be? Well, these are questions all of us are asking. And lately, we've had good news on the vaccine front globally. We've had Pfizer telling us their vaccine is 95% effective, and Moderna saying their vaccine is 94.5% effective. But these vaccines are expensive, and they also need to be stored at ultra low temperatures. Sometimes the Pfizer vaccine has to be stored at -70 to -80 degrees, which is actually colder than the Antarctic winter. So the whole world is really focusing on the Oxford vaccine, which is a vaccine which is available through COVAX, which is the WHO-supported organization, which provides affordable vaccines to poor countries. And there the vaccine is available for $2 a dose. And India plays a huge role here because we have Serum Institute and Mr. Poonawalla, welcome to the show, who have the capacity and the capability to manufacture millions of doses of these vaccines in a very, very short time. So now we're going to talk about how safe and effective these vaccines are. Global trials are going on already. We have the Oxford AstraZeneca vaccine, which is being, the trials are going on in the United States, in the UK, in Brazil, and South Africa, and the trial has also begun in India. So I want to ask Mr. Poonawalla, what are the early findings? What do the results show?
Firstly, a very good evening to all your distinguished panelists and participants here at the Hindustan Times Leadership Summit. Nice to talk to you. If we go back to April, May, never did I even dream, and my team here of scientists at Serum Institute, that we'd have such a good vaccine developed, or all these other vaccines developed so quickly by the end of this year. So whilst, you've got, as you rightly mentioned, the Moderna and Pfizer vaccines that are a little expensive and very difficult to store logistically because of their temperatures, they are seeming to be very powerful and effective. The real question is, how long will it protect you for? You want a vaccine that can protect you at least for a couple of years. That's the goal that the health community and all the developers are trying to get to. What we've heard so far is that the Oxford AstraZeneca product, that is one of the products that we're going to make, and I just want to correct you, we've done a deal at $3, not $2, with COVAX, which is, the body that is Gavi, CEPI, and WHO. The vaccine so far is proving to work very well, even in the elderly, which was a concern that we all had early on. It's induced a good T-cell response, which is an indicator for your long-term immunity, and then you've got a good antibody response as well. So time will tell whether these vaccines are really going to protect you for the long term. Nobody can answer that for any of these vaccines today. Anyone claiming that is, just shooting in the dark and hoping. We're all hoping that these vaccines, all of these vaccines, protect us for the long term. So we'll have to wait and see. Having said that, we in about 2 to 3 weeks are told that the UK and other studies for the Oxford AstraZeneca product, the efficacy results will be announced and the trial will be unblinded. So we should wait and watch what that has to say, and then we can decide. But irrespective of that, as you know, and we've been talking about it, that we've been making and stockpiling millions of doses ahead of time so that, we can get a head start on the supply.
So what you're saying is we will get results by, let's say, the first week of December from the global trials. What does the data from India show? Because a lot of people have been vaccinated across 15 centers here as well.
Well, there have been no safety concerns. Everything's been fine. And, even the Indian study is a much smaller study with 1,600 patients, because it's only a bridging study to show equivalence and show that it's the same. So at least from the safety angle, we've heard no complaints or major reactions, adverse events. So that's always a good sign. And that was, of course, expected because it had already gone through a safety study in the UK. So we'll have to wait and see. And even the results for that, the efficacy, partial immunogenicity results rather, that'll come out with the Indian study also in about a month and a half. So we'll wait and watch.
So if we get emergency use authorization, when is the earliest that we can get a vaccine in India?
Well,
So you all want to also.
yes, of course, that's the main question that everyone wants to know. And as soon as the UK authorities, the MHRA and the EMEA approves it for emergency use, we will apply to the drug controller in India, and hopefully very soon we can also get an emergency use authorization. Again, that'll be, just to clarify, a limited use for the frontline healthcare workers, the elderly, and all of that. So again, for everyone watching, it's going to take another 3 to 4 months before it's available, to the general public, because that's the way the emergency use licensure will probably work.
What you're saying is by April or May, we should all have access to this vaccine, right? In India.
That's right.
That's excellent. And what about children? Because will we have data on children by then, or will it just be for adults?
So in about 3 or 4 months, we'll have data on, the below 18 years of age group. Right now, the vaccines are recommended from 18 plus to, 90 or whatever. And so I think the children will have to wait a little bit longer. But the good news, as we all know, is that it's not so bad and serious for the children. So this disease, unlike other diseases like measles, pneumonia and all, which are very deadly for children, this disease is seeming to be less of a nuisance for children. And of course, they can still be carriers. If the schools are open and they get infected, they can give it to you. So that's why we want to vaccinate the elderly and others first, who are most vulnerable. And then once we have enough safety data to go on in children as well, then we can roll it out and recommend it, for children in about, I would say, 3 to 4 months from now.
So you tweeted yesterday saying that a good vaccine is a vaccine which is safe, effective, is easy to store and supply, and also offers long-term protection. So would you say the Oxford vaccine fits the bill?
Well, so far it's ticking all the boxes. Of course, on the point of the long-term protection, as I said, only time will tell. We need another 6 months to a year to know that. But of course, it's very affordable. It's certainly safe. And it's stored at +2 to 8 degrees, which is a temperature that, all the reefer vans and trucks that we have in India and the cold storages that we have, which is basically your logistics and infrastructure that India has, it's the ideal temperature. In fact, some vaccines will be at -20, and of course, some which are even harder to manage are at -70. But so if you look at, the different ranges of vaccines that are being developed, both in India and globally, +2 to 8 degrees is the best temperature.
So what is the vaccine going to be priced at for the general public? Because you said you offered it at $3 a dose to COVAX and the WHO. But for the general public, people like me, when I have to buy it from a chemist, how much do I pay for it?
It'll probably end up being around $5 to $6 a dose, with an MRP of 1,000 rupees. Of course, the government of India will be getting it at far cheaper because of a price, a much lower price, probably around $3 to $4, because they'll be buying they'll be buying large volumes, hundreds of millions of doses. So they'll get the access to the price which is similar to what COVAX has got, which is $3. And the general public, as I mentioned, will probably have to pay around 500 to 600 rupees. Today vaccines, like the pneumococcal vaccine today, for example, is around 1,000 rupees. So we're still pricing it far cheaper and more affordable than even some of the other vaccines that we have today on the market.
So you got into the act very early, way back in April. There was no viable vaccine then, and people were just starting to work on vaccines. So, you took many calculated risks. You've tied up with 5 different developers. So, what is your advice to other vaccine makers? Because it really gave you the capacity and the capability to scale up production very, very quickly. So do you think that's the way forward?
Well, I can't advise others on how to, take risks, because everyone has a different appetite to take risk. We are a privately listed company and don't have investors or other shareholders or bankers to be accountable to. So I was able to take a lot of risk. A lot of my critics said, oh, but do you know what you're doing? Why are you betting so big on this one or that one? If this doesn't work out, what are you going to do? You'll have lost hundreds of millions of dollars and, time. So we had to very carefully, scientifically calculate our risk. And that's why we chose and bet on these candidates, Novavax, Oxford AstraZeneca, and some of the others like Codagenics and the SPI Biotech RBD vaccine, because we had no choice. So at least I felt I had no other moral choice. It was almost my responsibility and duty. Otherwise, countless lives, would have been lost next year. Because imagine if I took the decision now at this stage, when we know that the vaccine is going to produce good results, we will have lost 6 months of hundreds of millions of doses next year, which would have been available at the end of the year instead of early on. And God knows how many lives would have been lost. So I took that call along with my team to just bet and commit and hope that all this would work out. And it has to a large extent. And it's been very stressful at that time when we were trying to get all this to work out and rejig capacity and facilities and manpower and get equipment in record time. We've broken records on everything. This sort of thing would have taken 2 or 3 years to do. We've done it in 4 months by rejigging facilities and, redesigning them and getting equipment there. So, it's been a Herculean task, and we're very happy now that we're almost now on an autopilot, waiting just for the vaccine results to come, and then we can churn out hundreds of millions more of the vaccine.
What are your production plans of the next few months, say from now to June?
Well, we're planning to make about 100 million doses on a monthly basis. At the moment, we're at a 50 to 60 million dose capacity on a monthly basis as an output. By February, we'll have gone to 100 million doses per month. So right now, I've dedicated 2 facilities. I'll dedicate another 2 facilities by January, February, which are getting validated. So that's how we'll double our monthly output, both to India and to COVAX. So that's the plan.
What's your agreement with the government of India? How many doses are you providing of both the Oxford vaccine as well as Novavax?
Well, it's ongoing at the moment, so I won't comment, but they want a few 100 million doses by July. So they want 300 to 400 million doses by July. I don't know if they'll take all of that from Serum Institute. I think they'll have to decide or comment on that. But we're gearing up certainly to give and offer that kind of volume to India and still have a few 100 million to offer to COVAX also by July, August of next year.
So there's no firm agreement as yet, right?
Not yet.
Talks. So neither for the Oxford vaccine as well as Novavax. Okay. And which are the other countries which have pre-ordered with you? Because I believe Bangladesh is in talks.
Yes, we've got Bangladesh. We're in talks with maybe even Nepal and some other countries in Africa. But we haven't really signed and committed anything else beyond Bangladesh at the moment because, COVAX itself is handling all of Africa, and that's a population of 2 billion. So we don't really want to right now partner with many other countries and have bilaterals because we won't have enough stock to give. We'll be then committing more than what we can supply. So we don't want to do that. We want to handle India as a priority first and manage Africa as well at the same time. And then after that, we can help out, as many other countries that may come forward.
You have tie-ups with 4 other companies. Which are the other promising vaccines and what are your plans for them?
So the reason why we tied up with the others was a 2-pronged approach. We wanted also to have in our basket live attenuated virus vaccines because those traditionally can manage with just 1 dose instead of 2 doses, which is what all these vaccines need. And also will give you a very long-term, strong, powerful protection. If you look at measles, because it's a live attenuated vaccine, it gives you that long-term, lifelong immunity once you take 2 shots or even 1 shot when you're a baby. So that's why we went ahead with Codagenics, which is a reverse codon and way of, removing the harmful properties of a virus, and it just basically is a way of attenuating the virus. And then we've got University of Pittsburgh in Pennsylvania, which is, using our measles vaccine with the COVID protein on it. So it'll become a combination vaccine of COVID and measles. And then you've got Novavax, which you know everything about. It's a spike protein, and Oxford. So that's covering up all the 5 that we have right now. And every 4 to 5 months, we hope to launch a new vaccine. So if we're talking about January for the Oxford one, every quarter after that, we're hoping to launch another one after that with Scodogenics probably being coming in at the end of 2021.
So we should have a basket of vaccines by the end of next year. So will we have all 5 or maybe 4 by the end of next year?
Well, I mean, if 2 or 3 work very well, so maybe we might not scale up all the others because there might not be any need to. And of course, you've got other Indian vaccine manufacturers also who will have some vaccines in the next 6 months. So I think India certainly is going to have more than enough supply of vaccines. How much India will start to help other countries is yet to be decided, because we don't know how much supply the other countries will be able to produce, and whether they'll take the Chinese and Russian vaccines as well. That's yet to be seen. So we don't know that.
What is the pricing? Because we're not competitive. When I'm talking about pricing, I'm talking about the vaccines which are in your basket, as well as other vaccines that will be produced out of India. Will they all be in the $5 to $6 range, or are you likely to have more expensive vaccines?
They might be a bit higher because, if their volumes are lower, then they may have to price their vaccines a bit higher. But I really can't comment on what the other vaccine manufacturers will ultimately decide on their price. They'll have to look at their costing. It depends on their technology that they're using as well versus what we're using. I'm sure they'll be as reasonable in their pricing as possible. But it'll all again depend on their yields, their technology, their volumes, and then they'll have to comment on that. But let me tell you, the Indian vaccine prices will always be probably half of what we're seeing, or half or less than what we're seeing in the West, with the $20 and $30 pricing that Moderna and Pfizer and other companies have publicly announced. Ultimately, I don't know if they'll come down on the price. Maybe they might, with public pressure and the global pressure which is there, because ultimately, if we're talking about $10, $20 vaccines, you'll need a budget of 60, 70, $100 billion, which the world doesn't have for vaccinating everybody. So we'll have to see.
Because I'm getting questions related to that. I have a question from Samar Verma, who says that you seem to be producing vaccines at a fraction of the cost of what Pfizer is charging. So do you think that some vaccine manufacturing firms may be earning supernormal profits from large government pre-orders?
Yes, absolutely. I mean, we saw that in the US. 100 million doses, for example, was bought by BARDA in the US from, I think, Pfizer, Sanofi, GSK, all those companies. Each one of them did a $2 billion deal for 100 million doses, which is roughly $20, as you know, per dose. Whereas we offered 100 million doses to COVAX, and then did another 100 million doses, all at $3. So, we are, what is that, about 6-7 times cheaper and more affordable. So look, their costing, of course, in the US and Europe is higher to manufacture vaccines, but I don't know how much higher it is. So yes, they will make those supernormal profits. I don't know how long they'll make it for, because the world will soon realize that there are other options coming out of India and China, at more affordable prices. So I think it'll all reach some kind of equilibrium in about 6 months to a year. It's only that, to answer your question of who's asked that question, is that initially there might not be a choice for governments to just pay these high prices. But eventually, when there's enough supply and alternatives, you'll see prices coming down drastically.
You have a lot of people knocking at your door saying, please, please give me some vaccines. I'm talking about governments, of course. So do you have a lot of that? Is it difficult saying no?
Government has reached out to us. And of course, we've had to give the same answer that, we have to look at supplying our nation, which has got a huge population. And then, we'll see which countries we can then help out on priority, and see where the most vulnerable populations are and the need is. And then ethically, as soon as we can supply to them, that's the plan. So, we'll all have to wait for a little while.
Concern also about this whole vaccine nationalism, saying that companies are just providing to their own country. So do you get accused of that? Or is it because you're providing to COVAX that...
That's the policy I took early on, because even I didn't know what to do. So I took a decision which ethically makes sense and logically, that give 50% of all my volumes to my country, because it's a very large country. And of course, because it's our own country, we have to look after ourselves first and then also others at the same time. Logically, why does that make sense? Because if you don't protect others in other countries, when they come to your country or you want their economies to open up for business, for imports, exports, other trade, we are all now connected as a global economy. So if they don't open up, we can't fully unleash our potential. All other sectors, whether it's auto, IT, steel, so many other entrepreneurs in India, they're dependent also on other countries and people traveling and opening up and making their products and services that, we need to sell or buy from them. So if we don't all open up, then we're, just looking inward. And that's where the US policies under President Trump were slightly off, and where he was only thinking about America, not realizing that in his own interests, he needed to look at other countries and helping other countries. And I'm sure the new president-elect will probably have a more global outlook, I assume, which is good for everybody.
Right, I have a question from Sunil Singh, who wants to know, do we have the storage and the transportation capacity for the vaccines planned across the nation? And do you think the private sector can really partner with government in that? Because the kind of volumes we are talking of is huge, they're massive.
Yes, so to answer that, we already have a lot of cold chain infrastructure which we use for our universal immunization programs. And I've been talking to the government at the highest levels, and they're also going to have to reach out to a lot of these private cold chain operators. And it seems, my team has also found quite a few people that we're going to tie up with also to logistically help the government and support at least transporting the vaccine initially to the 40, 45 odd depots across different states. And then after that, the government will have to distribute it and find other innovative ways to, not just use hospitals and clinics, but other ways and places where healthcare professionals can be deployed and we can vaccinate, and cover more people.
Right, then I have a question from Vicky Kapoor, who wants to know, have there been any significant side effects of the Oxford vaccine so far? That's something people are really scared of because they think
of course. It's any new vaccine, even we were concerned. And we found that after injecting the vaccine into thousands of patients of all different ages, from 18 to I think 70 plus or whatever, the mildest symptoms were there, your little fever, weakness, headache, which is normal of a normal cold that you'd get. And when they were treated with paracetamol, in 1 or 2 days, even those symptoms went away. So nothing beyond that. Initially there were those issues that were there due to those neurological effects that were being found, but they were completely non-vaccine related. Those people unfortunately had that in their family. It was a genetic or a thing found in their family. So it was ruled out completely by all the regulators that it was not vaccine related. So we have no real safety concerns now. That's the good.
Bhavesh Dattani, who wants to know approximately how many doses will be available by the end of the first quarter of 2021. He's clearly talking about the Oxford vaccine.
Well, as I said, at least 300 to 400 million doses, as we've always maintained, and we're on track for that. So that's what we're aiming to get, and there's no reason why we shouldn't reach that target.
We've answered this question before, but Mayank Agarwal again wants to know that, assuming a non-optimistic, pessimistic stance, what seems to be a fair timeline by which the vaccine will be available for public use, which is the question everyone. So
let me just clarify this point. We are basing the assumption of an emergency licensure based on positive UK results. So these are the caveats, that if we get caveats that if we have a good UK result coming in November, end of November, early December, we apply for an emergency licensure use. So you have the vaccine for, again, the vulnerable populations by Jan, Feb. And then, as I said, March, April for the general public. Now, if any of these milestones get delayed, then of course, and at the moment, there's no reason why we think they should be delayed. So if all that goes according to plan, these are the timelines that we're looking at.
We have a question from Ravi Vediswaran, who says, how do we know that the vaccine is safe, looking at the varied population with different co-morbidities? It's safer than COVID, right?
Well, yes, that's one way to put it, certainly. And also, if they want to read the actual publications that are coming out from Lancet and other magazines, if they really want to do a deep dive to know and understand, they can read all about the 20,000+ people that have received this vaccine, and also the same platform, the chimp adenovirus, which was used in thousands of people for the Ebola vaccine. So it's essentially we're using the same thing. That's where we had so much confidence, even in April, early on the safety, because this was an established technology and thing going into your body. It's not something new that we reinvented. It's not a new protein or a new messenger RNA or a new anything. It is something that is already established, was used in the Ebola vaccine by Oxford, and then we used it for this, and again did another safety for it again. So that's why we were very comfortable on it.
That's the reason why you took the risk and chose Oxford, which was my question at the start.
So early, yes, exactly. That was a major factor why we chose that, because we felt very comfortable early on the safety.
Right. Question from Kapil Bhushan, who wants to know, distribution would be a challenge. What are your suggestions in terms of making sure it reaches the last mile? I know it's not your job, but what would you suggest?
I think as many private players that could be involved and brought in to partner with the government, and their distribution network will certainly help. We need to see more of that, which I think is slowly happening. We need to train more professionals to be able to inject the vaccine, because don't forget, if we're talking about reaching eventually after April, the rest of the population, we can't expect everyone to come even from the villages into the cities. We want to be able to, because that will create more congestion, more challenges, higher challenges on social distancing and so many other things, public transport, all of that. You don't want to increase infection and disease whilst it's still there, just because you're trying to get people in centralized areas. So you want to be able to train people to have mechanisms and locations and cold storage in as many places outside of the city limits as you can, so that you can reach more people and not cause more infection and congestion than required, just because you don't want to have a place where you've got 1,000 people, thousands of people gathering together for the vaccine, because that's not good for anyone. So these are the kind of things that the government, which I'm sure is planning, would have to look at so that we have a smooth logistical rollout and all of that.
Growing population and increasing mobility, pandemics are going to be back. So how can the vaccine industry prepare for future pandemics? How would you prepare?
I think, instead of reinventing the wheel every time with a new technology to deal with a disease, the way that Oxford did it and others have done it, rely on proven technology platforms, both, and I'll tell you what the advantages with that is. Scaling up and manufacturing, you already know how to do that. So that's a big plus. You don't have to waste months figuring that part out, which is also a challenge, let me tell you. And partly that's why, the Oxford candidate was very easy for us to scale up. It was a known technology on cells and things that we were familiar with doing. The second advantage, of course, is safety. If you establish, I'll give you a simple example on this chimp adenovirus, on safety, the next spike protein that we could use on this, like we did with Ebola or Oxford did with Ebola, makes it so much easier from the safety profile and concerns from regulators and the public to go forward. So that's what I would advise. Stick to what you know. And in a pandemic, you always have simplicity is the key. If you're talking about finding new devices and ways and technology, you're always going to run into challenges for storage, for manufacturing, for safety, regulation, all of that. So you want to be as simple and traditional as possible so that your time to respond rapidly in a pandemic is reduced as much as possible. That's the lesson I've learned, at least, and I think everybody is seeing that now going forward, so we'll be better prepared for the future.
Is that the reason why the messenger RNA vaccines are far more expensive, because they're more difficult to produce? Because I believe development is much faster. You can't say we can't experiment with new things because we know how to do it the old way. Because you have to come up with new technology and use it to develop vaccines. So
I think they're probably cheaper to produce, but I really don't want to comment on it without looking at the process. Generally, as a rule of thumb, after you reach a few 100 million doses, the economies of scale completely supersede the technology variance. So, if you make a few 100 million doses of a vaccine, it won't really matter whether you do it on this platform or another. It's when you're looking at 20, 30 million doses, 50 million doses, that kind of scale, that's when the technology will play a role in your costing. The messenger RNA vaccines are just expensive because the big pharma have higher costs, and they've chosen to keep the pricing high, as they do normally for most products. That's how it is.
Word.
Sorry?
I said use the word, it's profiteering.
Well, I don't know, that's too strong a word. I think, of course, profits are always good because you need that. Of course, profiteering is bad, and I don't think the big pharma are trying to profiteer at this stage, and I hope not at least. I think initially, before they also know their costing, they've given a price. I'm sure that as the volumes pick up, they also will come down on their price, because nobody wants to be profiteering, or at least even be seen profiteering during a pandemic.
So are we on track to vaccinate every Indian by the end of 2021? That's another question we've got.
I think that's impossible, because as I had said earlier, it'll probably take 2 or 3 years before every Indian gets it. Not just because of the supply constraint of the vaccine, it's also having, you need 5 things. You need the budget, you need the vaccine, you need the logistical infrastructure, you need the people willing to take the vaccine. So these are all the factors that lead up to being able to vaccinate more than 80-90% of our population. Imagine that you have in the US and Europe, and I've always seen this as a general rule of thumb, that in the West, if you are generally questioning every fact that is thrown at you instead of accepting the science or what the government tells you to do, you will have issues in a situation like this, and we can't afford to do that in a pandemic. We need to protect everyone as soon as possible. So these will be the factors why India and other nations, not just India, will take 2 to 3 years, as I stand by my statement I made a few months ago, that it'll be 2024 till everybody, if willing to take a 2-dose vaccine, will get vaccinated and protected by then.
Most people in India are accepting of vaccines. We don't have vaccine denialism, at the same level as the United States.
There is. You'll be surprised, in certain communities and other parts of India, you have a lot of resistance only because of lack of knowledge. If you have fear because you don't know everything about something, naturally it's only natural, and I don't blame them for being fearful. So it's our job, it's the media's job, it's the government's job, the manufacturer's job to explain, using social media and other means, whatever other means, to communicate the real facts on the ground, share with full transparency the information so that people know about safety and the merits of taking a vaccine as opposed to not taking it, and then just being vulnerable with their families to getting a disease. So it's our job to continuously educate them, because there's so much fake news, there's so much other news coming. There all these WhatsApp forwards come from the West. One guy gives it to 20 people here, and then thousands of people read it, and then they get scared and someone twists the words, and you know how things get carried away. So we need to really keep an eye on it and continuously message and give the facts on the ground to people so that they're not fearful of and understand what's going on. And then I'm sure, we all will come to the same conclusion that taking the vaccine is far better than not taking it.
How are the Novavax trials going? Are results expected soon?
Absolutely. In fact, even in December, so that's coming in also at a good time. Scaling up that product will take a little bit longer because, the facility that we designed for it was ready, I think, about 3 months after. So we'll probably be, as I said, 4 months behind the AstraZeneca product with Novavax.
By Christmas, you said? Christmas, New Year?
Months behind. So as I said, if we're saying January for Oxford AstraZeneca, we're saying another 4 months for the Novavax to hit. Yeah, the trial results should be there by December, yes.
And I was thinking we can look forward to a happy new year after a very, very dismal 2020.
No, absolutely. Yeah.
So some reason to, well, party with a mask at home alone. But I have a question from Jahnavi Malhotra, who says, do you plan on increasing your production capacity once this pandemic is over so as to be better prepared in case of a new pandemic? Could you just explain the whole, vaccine production process?
So when I took over, to give you some background, in 2011 as CEO, the first thing I did was to double our capacity for existing vaccines, because not only did I want to build redundancy in case things went wrong, but I also wanted to, and I knew that the demand would keep growing, but I wanted to prepare for a pandemic level event ever since I heard Bill Gates in a TED talk, where he clearly said that we should probably be more worried and spend more money and funds, whether it's governments or others, on building this kind of capability and capacity than even nuclear or other things, or even space programs where we spend billions, hundreds of billions of dollars as a global community every year. So that got me thinking, and in fact, ironically, a year ago, I started to commission and build the world's largest pandemic facility with a capex of around 3,000 crores to produce more than 1 billion doses. So that's going to be functional in about 2 years. So that'll add another 1 billion dose capacity to what we've already rejigged right now. And that's a multi-product facility which can handle any pathogen, bacteria, virus, everything, proteins, messenger RNA as well, once and for all. So, we will have a multi-product pandemic level facility to handle 1 billion doses of bulk and fill finish in about 2 years from now. And I started doing that about a year and a half ago. So that was my thinking. That's what, we've been doing for the last few years. And that's really coming in handy. And, we may even expand on that going forward.
Hopefully what you're saying is in probably another 2 years, we'll be producing 80 to 90% of the world's vaccines. Or we'll at least have the capacity to do so.
Well, I don't think so. Because I don't think so, because I think all the other Indian and Chinese vaccine manufacturers are also going to scale up now, and you're going to see a lot of other vaccine manufacturers coming up across the globe, because everyone's now realized that this very niche and small underrated industry is not only essential, but also quite profitable, if you're able to make large scale good technology, good production, and a lot of pharmaceutical companies also in India, which were never making vaccines, I think Zydus and Aurobindo and others, are also seriously looking at making vaccines. So, the demand is also growing, but you'll see a lot of new players also coming in into the fray.
Let's start. So, who is your closest competitor? Which other country? Would it be China? Would it be Malaysia?
Well, we have all global competitors, you've got excellent companies. Sorry, I can't hear you very well.
In terms of volume? In terms of vaccine volume?
Oh, you've got Indian vaccine manufacturers also who can make hundreds of millions of doses, like Biological Evans, Bharat Biotech, Panisha Biotech. You've got the Chinese and South Koreans who are also scaling up a lot and will be able to make hundreds of millions of doses. And of course, you've got your Western companies, Sanofi, GSK, Pfizer, Johnson & Johnson. So, there are about 10 to 15 serious players in this field globally.
Ask you some very rapid questions because I'm getting loads of questions for you. I have a question from Aishwarya Anita Arakal, who says, is there a chance that the virus will mutate to a more aggressive strain after the vaccine and is developed and is getting ready to be distributed? If so, what would be the next step that we would be looking at? So if you have a more virulent virus, will the vaccine still work? That's the question.
Well, it depends how much it will mutate. If it changes a lot, then of course the existing vaccines may not be very effective against it. So far, there's no signs of the virus mutating. Of course, that'll really be bad news for everybody because all this effort and euphoria and excitement will have been wasted and been for nothing. Well, not for nothing, we've learned a lot, but of course, yes, to a certain extent, hypothetically, if the virus mutated significantly, we'd all have to go back to the drawing board to make a new vaccine. And, obviously that's going to be very bad. But at the moment, that doesn't seem to be happening. And, we're not seeing a lot of signs for that. So that's good news.
How long is the immunity from the vaccine likely to last? And she also wants to know whether the manufacturing of the COVID vaccine affects the production of vaccines which we use for routine immunization. Because again, we use a lot of those vaccines.
Of course. So that was a very important question and challenge where we had to ensure that all the other vaccines that we're making for babies and infants continue, and there's no shortage on that. And the other question, of course, the earlier part of the question was how long will the immunity last? Nobody knows, as I said early on. Only time will tell, but the early signs are that the T-cell response is looking good, which is an indicator to provide long-term immunity. But we'll have to wait 6 more months at least to be able to judge and then comment how long these vaccines will protect us.
A question from Harsh Rai, who wants to know that keeping in mind we have an existing flu shot.
Interference, can't hear you very well.
I have a question from Harsh Rai, who's saying that keeping in mind the existing flu shot, will people need the COVID vaccine and the flu shot together once the COVID vaccine hits the market? Because he says, do you need double protection?
Well, of course, as you know, the flu vaccine is for something totally different, and you should take that as well. Probably keep a few weeks gap between vaccines. That's always sensible. And there's no harm in taking the flu vaccine and, of course, the COVID vaccine as well. I highly recommend that you take both.
So I have a personal question, because your dad set up the Serum Institute way back in 1966. And now you're supplying to 170 countries. And these are life-saving vaccines. Some estimates say they've helped save 20 million lives. So what does he feel about the role Serum Institute is playing now in such a pivotal role in fighting a pandemic?
Well, he's just so happy and excited that in his lifetime, when he started this company, never did he ever imagine it would grow to this level as a global vaccine player. He was only trying to address this huge shortage of vaccines that existed back in the day in India, and we were dependent on imports, and he wanted to address that issue. So certainly to see this happen in his lifetime is the best reward that he could have ever imagined for all his hard work, blood and sweat that he went through. And he really struggled, because in those days, getting permissions, getting access to funding, getting good talent, those were the challenges that he really had to grapple with, which is of course there even today, but nowhere close to the extent of what he went through. So this is the ultimate, I guess, reward that he can see, that we've come so close to this stage, and he's so happy that this company that he started with $10,000 capital in those days has come to where we are today.
So since you took over as CEO, do you see the difference? Do you see that? Is it easier for you to talk to people, and do they take you more seriously when you talk about how vaccines can save lives? Is it easier to find buyers? How has it changed since you've taken over?
Well, it's changed dramatically in the sense that, when I joined in 2001, just to talk about the last 20 years that I've been in this business, getting permissions, launching new products and vaccines was so difficult and bureaucratic that took years and years to do. We didn't really have that much of a global reputation at that time also, to cite another challenge. So going to other countries to expand was very difficult. They didn't know what this company was. They never heard of it. So, that of course changed in the last 20 years, and then rapidly, of course, even more than that in the last 10 years, as we kept growing and building a brand. So, those were the challenges that I saw. And of course, that attracted better talent as well. When you're better known, you're seen to be a leader, and a global player, you attract talent, and that also helped us grow because we need so many people. Now we've got 7,000 employees. That's doubled in the last, I would say, 6 to 7 years. So we've been growing exponentially in the last 5 to 7 years as a result of all these things that have been happening over the last 5 decades.
Do we have enough talent in India, or is it difficult to find the right people? Because it's such a niche.
No, I think, and we have a very good way to train also talent that has got some experience. So it's a combination of ready-made talent that, yes, there is there in India. And a lot of people, don't forget, of now moving back to India as well because of the opportunities and growth that they're seeing over here. So that's also a good thing that's been happening in the last 5 years that we've seen. And it's always hard for a complete foreigner to relocate to India and live here for a long period of time. We always have had the ethos that when you join Serum, you're there for life. We've got people working for 30, 40 years in Serum. And so we create that culture and we train them. So even if they come from a pharmaceutical company, we train them in our area and expertise and field, because that's the only way to build further talent and grow. Otherwise, it's not possible to depend on recruiting globally to live in India and manufacture in India.
One of the key things that's emerged from this whole pandemic is how private players are working very, very closely, not just with scientists, which you've always done, but also with governments, like your trial in India is with ICMR. So do you see that to be the way ahead when it comes to future development, or is it just because of the pandemic that we have that sense of urgency on part of the government as well?
ICMR, DBT and other departments and the government, because it's always good to do things at scale together with the government. You don't necessarily have to always choose that path. Sometimes it makes sense because they have a lot of infrastructure and scientific guidance and knowledge that they can also contribute to. So it's a nice way to have public-private partnerships. It's worked out generally quite well. And also it helps to further progress in the regulatory front, because then you're kind of aligned all together, doing something together. So it's always been a plus. And yes, we do look at doing more things like that in the future as well.
Thank you so much.
Okay.
And thanks for joining us.
Pleasure being with you. All the best. Thank you.